So right about there. And then he starts to posteriorly tilt his SSI. So it's about 90. That's what I expected. Okay. So what I'm going to do is I'm not going to try to grab in here and get his femoral head. I can't. Well, I can, but it's going to be super uncomfortable because there's nerves here on top of genitals, right? So what I am going to do, though, is I'm going to support his leg, and I'm going to try to get his femur into around here, around my coracoid. So I'm going to make him give me a myofascial release while I do this, right? Okay? And so I'm just going to use my body weight, and then I'm going to reach behind to try to stabilize the ilium. And he won't really feel too much, maybe a little pressure on his knee.
Are you solely moving in sagittal plane, or there is some sort of...
I am pushing down behind him. I guess you would call that sagittal. So I'm pushing straight down with my body. So I'm just giving him more weight to support. Like he's supporting me, essentially.
Okay.
So I'm not trying to like use my abs. I'm just leaning on him. Okay? So now let's see. So this one is a stretch because what I know from being a student is that he's sitting a long time, so the joint capsule's actually gotten tight. So I'm not doing a Maitland style. You'll have to figure out what it is for your patient, but I know just because I know his life that it's all the years of class, right? I mean, you're classy all the time, but school, I mean, relax. Okay, feel a little bit better?
Yeah.
Okay, so now I need to actually improve his end range, so I'm going to take him a little bit further. So I got to change my angle. Okay, so here we go. And so now I'm leaning forward and down. So I'm kind of leaning, there we go, towards there. Feels okay, just feels a lot of pressure. Jose?
Yeah. No, I don't feel much.
Okay. So if you're really good, you can kind of feel the femur push into your fingers on the bottom hand. Okay, and then we'll go a little bit further.
And you're just doing slight movement or just one stretch?
I'm just doing one long push.
Okay.
So I'm just shifting my body weight onto his femur.
Okay.
Push it down.
Yeah, this is a lot harder than it seems. I'm using his femur as an arrow that I'm pushing there. Okay, so let's check again. Relax. See, it's getting a little bit better. We've got more work to do. Eventually we're gonna hit into glute max tightness, which is probably where we're getting now. Like you feel a little stretch in your butt.
Yeah.
And now pull both knees to your chest as far as you can.
No.
See the difference?
Wow.
Can even tell from the foot.
I know. All right, so give it a try. So lowest table you can find.